In epilepsy, the normal pattern of neuronal activity becomes disturbed, causing strange sensations, emotions, and behavior, sometimes convulsions, muscle spasms, and loss of consciousness. Postictal psychosis often complicates chronic epilepsy, especially in patients with seizure clusters that include tonic-clonic seizures. Psychosis includes delusions, auditory and visual hallucinations, mood changes, and aggressive behavior. A degree of confusion and delirium, for example, impaired attention, alterations in sleep-wake cycle and motor activity, and increased autonomic activity, often coexist with psychotic features.
In spite of seizures, most people with epilepsy lead healthy, outwardly normal lives. Epilepsy is not a disabling disorder.
Except for seizures, there are very few clear physical or mental indications of epilepsy. Every problem the brain experiences shows itself as some form of behavior abnormality. It could be the symptom of an unrelated problem or disorder. Most people lack the medical knowledge to understand the difference, and they are often mistaken in the belief that they have experienced an epileptic seizure.
The risk for epilepsy is higher in people with certain medical conditions such as traumatic brain injury, stroke, Alzheimer's disease, autism, and brain tumors.
A neurologist must review the patient's medical past as well as his or her present medical condition, and a successful diagnosis requires a very strong relationship between patient and doctor. There are two reasons for this. Seizures themselves are very difficult to study. They strike at random and only last a short time. Therefore, it is hard to catch them in the act.
Personally, I think a doctor should do a bunch of tests like EEGs, like Susanna Cahalan had. I've had it a bunch of times, which just kind of detects your brain waves to be able to sense when you're having a seizure. And to be able to diagnose epilepsy, I think it should be reoccurring seizures that you have all the time. It shouldn't just be seizures every once in a while, because 1 in 7 people in America have seizures once in their lifetime. So you could have a seizure and you could not have epilepsy. It could be a side effect of something. So you should have reoccurring seizures, and that should be something that doctors look for when diagnosing epilepsy.